behind the patient. Dr. A.V. Guruva Reddy reminds us why the human side of healthcare must never be left behind. Dr. Reddy is an accomplished orthopedic surgeon with a remarkable 33 plus years of experience in joint replacement surgeries. He is a founder member of the Indian Society of Hip and Knee Surgeons and is currently the chairman and managing director of KIMS Sunshine Hospitals. He has established the Survey Jana Foundation to help enhance the lives of those at the bottom of the healthcare pyramid. I now invite Dr. Reddy to speak on the topic, Embracing the Human Side of Healthcare.
Good morning, everyone. It's a great privilege to be here. I've addressed it so many times, so many gatherings, but this is divine. 15 years back, let me share an anecdote. I'm not an atheist. I don't go to the temples to pray, but I believe that there is a superhuman power that guides you. One day I got a phone call from then Minister of Women Welfare, Geeta Reddy. I was busy in my OPD. She said, Doctor, you got to give me 2 days of your time. I want you to come to see one patient. And after 24 hours, I was in Puttaparthi to see Swamiji. And I entered, as I said, I never believed in God or Godmen. But the moment I entered this place, some divinity touched me. There were definitely some repercussions inside my heart. Then I thought there is something divine here. But of course, I had a greatest respect to Swami even before I came here because of his social commitments and social achievements. To provide a drinkable water to the whole district is not a thing a human being can do. So that sort of respect I had. And I don't think any of you had that privilege of me spending 45 minutes one-to-one with Swami. And I touched his feet. I examined his hip. At that time, he was having a pain because of the hip replacement. He had a hip replacement before. And his feet were such a soft, dainty, like a child's feet. And I was so astonished and I was flabbergasted. I was not having any words to describe that experience. And Swami gave me a ring. And then he called me to Bangalore to top it up and I had a lunch with him. And so those were my memories with Swami. Though I'm not directly related to Puttaparthi, I was inspired by him and I try to emulate a lot of things in my practice. And that's why when Anil Mulpur has given me this talk, I was very happy because there is a human angle behind everything. The higher you go in the corporate sector, the more human you should become. I can see my colleagues, Dr. Guruva Reddy, Dr. Giri, and coming regularly serving this great institute. And like that, Dr. Sundaresh is here, who has dedicated himself to service of Baba. So I just wanted to emulate, what is it? As Swami said, the love and compassion are fundamental to the human service. Unfortunately, present context, the doctors are seen in a bad light. Not all the doctors are bad. 90% of the doctors are good. We all start from home to serve the people, not to kill the people. But unfortunately, thanks to the thanks to the media, thanks to some unscrupulous doctors, the doctor-patient relationship has gone for a toss. But even in these circumstances, doctor's life feels very lonely. The press don't trust us, the patients don't trust us, so it's very lonely being a doctor nowadays. I'm sure Madam is there. She must have seen all this. But having said that, there is a need and there is a role and there is an appreciation and there is a recognition for a good doctor that all the doctors working in Sathya Sai Trust have proved that. Yeah. Thank you, sir. So I'm just going to next 10 minutes. How do you change this slide? This one? Not moving. Okay, right, yeah. Okay. Okay, fine. Right. I will remember that there is art to medicine as well as science, and that warmth, sympathy, and understanding may outweigh the surgeon's knife or the chemist's drug. Our father Hippocrates' slogan. Healthcare is not just about science and technology, it's about people. The human side of healthcare emphasizes three elements: empathy, communication, and trust. Today, we explore how prioritizing humanity improves outcomes for both patients and providers. Improved patient outcomes, better communication leads to more accurate diagnosis and adherence. And provider satisfaction, even for the doctors, emotional connection reduces burnout and increases job fulfillment. That's why I can see all the doctors working in Sai Institute are so happy, and I can see that radiance in their faces. And system efficiency, trust and compassion reduce complaints, legal issues, and repeat visits. The pillars of human-centered healthcare are three: empathy, understanding the patient's feelings and perspectives; communication, clear, respectful dialogue; and respect, treating every patient with dignity; and presence, being truly attentive and available. Now, there is difference between sympathy, empathy, and compassion. A lot of people mistake sympathy with empathy. Sympathy means you are at a higher level, patient is at a lower level. No, that's not right. So sympathy is I care about your suffering, whereas empathy, I feel your suffering. Whereas compassion, I want to relive your suffering. So it's the next step of sympathy. So sympathy is acknowledging, empathy is acknowledging and understanding, whereas compassion is acknowledging, understanding, and elevating. All the people in this audience of Sathya Sai service are in the last thing, compassion. And again, sympathy is I feel for you. Empathy is I feel with you. There is a difference. And compassion is I am moved by you. And again, this is a scale on which you can see that right side effort and the bottom side understanding and engagement. Pity leads to sympathy. Sympathy leads to empathy, and then compassion. So the effort, you can see that compassion, you need a lot of effort and a lot of understanding and engagement. There are three types of empathy: compassionate empathy, cognitive empathy, and effective empathy. Compassionate empathy is understand what you feel and want to help. Cognitive empathy, I put myself in your shoes. And effective empathy, I feel with you. There are many ways to cultivate empathy. I just go through this. Volunteer, that's what you're all doing. Listen actively. The better way to do something is first you should listen. Reflect back, practice gratitude, avoid judgment, be open-minded, ask questions, share your feelings, stay humble, be kind, be respectful, read fiction, be curious, use I statements, show compassion, practice patience, practice mindfulness, acknowledge emotions, observe body language, learn about others. All these 20 are embodied in every doctor practicing in this guardians. Now, empathy in action, how it starts: active listening. Very important. Very few doctors in the busy practices nowadays don't spend time at all. Even I myself spend 3 to 4 minutes with the patient because I've got a big clinics and all that. But I see that those 3 minutes are enough to touch the soul of the patient rather than the knee of the patient. And validating patient emotions. First of all, listen to the patient's problems, then summarize them. That is the best way to answer the patient's problems. Using body language and tone to convey care. The body language is very important. The moment a patient comes into my clinic, however busy I am, first I do is put my hand on the shoulder. There are 4 T's that are very important to establish any relationship. That is a touch, time, trust, and talk. And doctors have forgotten the beauty of the touch. Real world example, a doctor who takes an extra 2 minutes to sit and talk. Again, busy clinics, doctor stands, patient stands. No, sit and talk. And again, in our hospital, healing start the moment you arrive. Again, a lot of things are inspired by Swami. And again, our drivers open the doors of the car. The wheelchairs are next to the car. Nowhere the patients need to search for the wheelchairs. And they are helped into the wheelchair. The lift girl also is taught how to say namaste and how to say thank you like that. And next pillar of personal is communication. And again, communication is very vital. Avoiding jargon, asking open-ended questions, checking for understanding, cultural competence in interactions. I always ask the patient to tell his symptoms and then I summarize them. So you have knee pain, back pain, neck pain. And then when I give my treatment, I again summarize them 1, 2, 3 like that. So that is the communication. And again, we developed a vertical called Apyaya. That means you all know that affection. And that is a vertical, again, inspired by Swami. And this is where the communication and empathy come into that. And again, I told you trust, time, touch, and talk. The 4 T's to nourish and nurture any relationship in the world. Either it's a lovers, wife and husband, father and daughter, patient and doctor. These 4 T's are good enough. Too often we underestimate the power of a touch, a smile, a kind word, a listening ear, an honest accomplishment, or the smallest act of daring, all of which have the potential to turn a life around. When I go to the rounds, I hold the patient's hand. Again, time and again, I have to literally extricate my hand from the hand of the patient. He won't leave that hand. And that is the power of the touch. We got this 20-page communication things to give the patient, and we stopped calling the patient as a patient. And again, the trust, honesty and transparency, consistency in care, respecting patient autonomy and choices. Example, shared decision-making models, which is very common in Western countries, but it is now slowly catching up in India also. And as I said, when I explain to my patient about knee replacement surgery, I tell him the other options also, and I ask him to take care of, tell the options. And again, coming to the healer, always there is a superhuman power, where it can be Jesus Christ, or it can be Sathya Sai Baba, or it can be Allah. Some power is there to guide you to the difficult times. So that is when you feel empathy yourself as a doctor, the emotional toll on the healthcare workers is real, and that will take care of this one. Encouraging the peer support, reflection, and self-care, institutional policies that protect mental health and promote resilience should be there in this one. So caregiver is also very important. Now, integrating technology without losing humanity. Again, it's one of the slides I've seen in the madam slides. Technology is very, very useful now. And with the telemedicine, you can reach thousands of people in the remotest areas. So use technology as a tool, not a barrier. And maintain eye contact even when using digital records. Personalized virtual care wherever possible. The biggest criticism in American healthcare now is the moment patient comes, the doctor opens the digital health file and he forgets to see at the eyes of the patient. And this is my video rounds. Even today, this morning from the Shanti Bhavan room, I did my video rounds. This is a small technology which is tremendously helpful. So patients react so well that this doctor is not in the city, but still he wants to be in touch with me. Just one word, how are you? And that's it. See the happiness of the patients. This is this morning. Okay, and now thanks to the technology, there are robots have come with the mobile video facility. The robot will go into the room and then you switch it on and you can talk to the patient even if you are 1,000 miles away. So tomorrow and day after tomorrow, I'm going to America. And again, I'm going to talk to the video rounds. I'm buying one robot to do the robotic rounds. So technology is going to enhance the human face of it. So how we can embrace humanity more? By training in empathy and communication. Morning, madam rightly told, there should be a curriculum in medical school about the empathy and the communication and the treating the patient as a human being, not as a case. And you can see that all the medical students says, there is a case in Ward 3, there is a case in Ward 2. What is the case? He's a patient. He's a human being. We forgot that he's a case. Encouraging patient narratives, designing healthcare spaces for comfort and dignity, leadership that models compassionate care. All this morning when I was listening to the previous lectures, all my slides got life. All the things which I wanted to tell have been given a beautiful, respectable position in the society in the actual doing. As Anil was saying, Swamiji told another 1,000 years. And wonderful, another 1,000, 10,000 years, this embodiment of grace, love, and dignity will be there. And call to action, how do you do that? How do you show empathy in your daily practice? Reflect yourself. Each doctor in this audience, go back and say how many times you showed empathy. Treating the patient, writing a prescription is not empathy. Act. What can you change today to connect more deeply with your patients? And advocate support systems that value humanity alongside innovation. And again, these are some of the examples. My driver, Schaffer, also is trying to do that. And again, everywhere there is a good morning and welcome. And all the people waiting in the outpatients are given free coffee, tea, sandwiches. Nowhere else except in Sai Baba Center. It is not possible in any corporate hospital. In fact, Sangeeta Reddy from Apollo Hospital got me in one of the marriage functions and said, Guruva, you are doing this. How can we all match up with this? So it has to be done. It can be done. When I told my chairman also, when I take 1,000 rupees consultation fees, 200 rupees is for the patient comfort. Full stop. You go to the balance sheet. I don't care about financial balance sheet. I'm caring about emotional balance sheet. I see 150 patients every day. I do 4,000 surgeries every year, not because I got a 2 hands or not because I've got a 4 hands, because of the human touch. I always say you should be big enough to serve and small enough to listen. That is the epitome of any hospital, however big it is. And again, all the patient relatives waiting outside the theaters are given free lunch, dinner around the clock. These are all simple things. They cost money, but it is worth it. And it has to be done to tell the patient, look, you are cared and you are taken care and you are respected. That's as simple as that. And these are all some of the things in my hospital. And we wanted to eliminate the name patient from our dictionary in the next 2 years. Guest first. That is what we want to do that. I tell the patients and my registrars, he is no more a patient, he is a guest who is not well. How do you take care of the guest at your home? Do the same, all the things fall into place. So these are some of the initiatives we have taken, and healing starts with all of us. And healing is not just our job, it is our calling. And that's why we started this APIA, a vertical. And because care is not just for patients, it is for families too. You treat a disease, you win, you lose. You treat a person, I guarantee you, you will win, no matter what the outcome. Patch Adams is a movie. If anybody has not seen this movie, go and see that movie in the evening. One of the most, it's like an English version of Munnabai MBBS. And it's a wonderful movie, see that movie. And it is not how much you do, but how much love you put in the doing. That's what in the 5 principles of Swami, the loving care, comprehensive care, preventive care, everybody reads in social and preventive medicine textbooks. But that loving care makes all the difference. And that's why you proved, and I will be happy to be part of this one. As I said, I also started a trust, and I'm doing one for mother, one for other. That one knee replacement, a mother, and one free knee replacement to somebody who can't afford. అది తెలుగులో తెలుగులో కని పెంచిన అమ్మకు ఒక మోకాలు కని పెంచని అమ్మకు ఒక మోకాలు అన్న స్లోగన్ తోటి వీఆర్ గోయింగ్ అండ్ వీఆర్ డూయింగ్ లాట్ ఆఫ్ థింగ్స్ దేర్. Like that, second vertical in our trust is to prevent road traffic accidents. And again, let me tell you, I think Swami Trust has to put efforts into this at some stage. I am ready to offer myself, because all these things, at least orthopedic things, start from the accidents, which are 60% are preventable. You will be astonished to know that India submits to 1% of the vehicle population of the globe, and it contributes 11% of the road traffic deaths global. It's astonishing and absolutely disgusting. And 60% are man-made. So I'm doing a big vertical on in my trust. At some stage, I will come to the trust people, and with your might and with your focus and with your outreach, we should do something more preventing the accidents so that the bread earners are disturbed. Here, the bread earners, for no fault of them, for a pothole, the man loses his life. And so there are a lot of things are there, which I request the trust to put an eye on to that. And I'm sure with your insight, we can do more things in the future. This is the last one. Anatole Boyard is one of the great writers. He says he's a patient. He got a prostate cancer. I won't demand a lot of my doctor's time. I just wish he would brood on my situation for perhaps 5 minutes, that he would give me his whole mind just once, be bonded with me for a brief space, survey my soul as well as my flesh to get to my illness. For each man is ill in his own way. Just as he orders blood tests and bone scans of my body, I do like my doctor to scan me, to grope for my spirit as well as prostate. How beautifully he has written. To grope for my spirit as well as prostate. Without some such recognition, I am nothing but my illness. So, my friends, kindness is a language which the deaf can hear and the blind can see. This is the epitome of all this audience. And thank you so much for your kind hearing.
Thank you, Dr. Reddy, for emphasizing that it is the human connection that truly completes